Bismillahirrahmanirrahim. Assalamu alaikum dear students. We are here with our last part on the antiviral drugs. So far we have covered various drugs used for the viral conditions like herpes simplex, varicella zoster, cytomegalovirus, drugs for influenza and other viral infections. And in the previous lecture we started with the antiretroviral drugs, basically the drugs used for the treatment of HIV. That's a very important topic, and from examination point of view as well, the classification has been repeatedly asked in the exam. And with that, I would like to add on a little bit about the drugs, especially the antiviral drugs which are used for the COVID-19, which was the pandemic of 2020. With that, we move on to today's content. As this is a flow diagram showing the distribution of various antiviral drugs, and let's have a look. We have covered which of these. We have done the drugs for herpes, for influenza, for hepatitis B and C, and we started with HIV yesterday, in which we have covered RTIs, and the RTIs were of two types: nucleosides and non-nucleoside derivatives, and today we'll be covering the rest of them. Once again, this diagram was asked in the exam, and you were supposed to draw it and submit it for the assignment, and most of you have drawn a very nice presentation of this viral replication cycle as well as the drugs acting at the various steps. I really appreciate it, and if you have drawn it with the help of guidance from your book, kindly practice it, as it is a very important university question. So we continue from where we left. Basically, these are the drugs, non-nucleoside reverse transcriptase inhibitors and non-nucleoside reverse transcriptase inhibitors, which are acting at this stage. And we discussed in the previous lecture that the nucleoside reverse transcriptase inhibitors bind competitively to this enzyme and inhibits its action. Similarly, non-nucleoside, they basically gum up with this enzyme and halt the process of replication at this step. Once again, I would like to remind you regarding the cocktail therapy for the HIV. The significance of this cocktail therapy is that we always add two or more drugs, usually of our RTI along with the a protease inhibitor. Two RTIs and a protease inhibitor is the combination which is used, and once again the property is the advantage of this combination is it enhances the potency and delays the chances of resistance. We also discussed about the heart, that you should know okay, what this HAART stand for, and number two, you should know okay, what are retroviruses, which I have already covered in the previous two lectures. Once again, this diagram which is showing how the various drugs are acting at the various steps, like RTIs of two types. They are acting at this stage. Then integrase, which is inhibiting the incorporation of this DNA into the host genome. So the integrase inhibitor inhibit this step. Then we give protease inhibitor, which are acting at this step for the release or the final structural proteins. This is another classification to memorize the antiretroviral drug therapy. We classify them as RTIs, which we have covered, nucleoside and non-nucleoside, and you have to memorize 3 to 4 names at least. Then we have the entry inhibitors or the fusion inhibitors, in which we have enfuratide and maraviroc. Then protease inhibitors, which we are going to cover just now. It comes ritonavir, duranavir. Basically, at the end of their names, there is coming navir. Okay. Then we have integrase inhibitors, in which we have these drugs like dolutegravir and reltigravir. I am again and again emphasizing, just like the classification of cephalosporins is a bit difficult to memorize, similarly the classification for antiretroviral drugs is also a bit difficult, but there is no other option for you because you have to memorize it. It's you can just memorize it in the form of rectification because there is no concept in the names. Okay, you can make mnemonics to memorize it, and this is your assignment for today's lecture, that you have to classify antiretroviral drugs. And please put an effort to it. Search your big cat zinc, Lippincott, and the mini cat zinc. And after that, make a good classification with at least 3 to 4 names in each group. And then I will assess if a student has attempted the best one. This diagram is again showing the sites of action of various drugs like protease inhibitors. Number of drugs, you see there are at least 10 drugs in each group, like in protease inhibitor, but the rule is that their names are containing nowhere, so you can memorize ritonavir and danavir, which is inhibiting at this step of release of the mature HIV virion, which is full of which is very infectious. Okay. Similarly, we have the fusion or the entry inhibitor at this stage. We also call them the CCRF5 receptor blocker. And then we have the integrase inhibitor. As you can see that this is the uh, viral DNA which is incorporated into the host cell and for making a new viral DNA particle. So this step is blocked by integrase inhibitor. And we have the RTIs, which is basically converting the viral DNA into, which is basically converting the viral RNA into the DNA with the help of the reverse transcriptase enzyme. So these we have already covered. These are nucleosides and non-nucleoside RTIs. In the nucleoside, since the name is indicating that they are nucleoside derivatives, so they may be pyrimidine analogs. In pyrimidine, we have thymidine analogs and cytidine analogs. Similarly, in purine analogs, we have guanosine, adenosine, and inosine analogs. And in non-nucleoside reverse transcriptase inhibitors, of course, you have to memorize the name. There's no other option like delvaradine, nevarapine, efavirenz. Names are difficult, but of course, they come in the exam. And especially if you just learn the classification of these drugs, then you will be able to solve many MCQs, because if they ask you which of the following drug inhibits the step of the and release of the new viral particles. If you are given many options like zidovudine, cevudine, or indanavir, sequanavir, if you know, I have learned in the classification the step of release is inhibited by this protease inhibitors, so you can easily answer the MCQ. So the classification is very important. So students, I'm emphasizing again and again that memorize the names, and by that you will be able to write down the mechanism yourself. If you memorize this diagram, there is no difficulty in writing down the mechanism of action of any of the drug. If you know the replication cycle, there would be no difficulty. Okay. And you can also go to the YouTube and just click on a small video to show the mechanism of action of antiretroviral drug. They explain very beautifully, right? So with that, we move on to our next presentation. This is again the same diagram showing a brief elaboration of the various steps inhibiting the viral replication. Now we move on to the protease inhibitors. They include the ritonavir, nelvanafir, sequanavir, and same names. They are basically the protease enzyme is responsible for the final structural proteins, basically the mature viral particle which is released, that is under the control of protease enzyme. Okay? Or students, instead of memorizing the detail of each of the drug, it is important you should know the general characteristics of antiviral drugs, whether they are for the other viral infections or whether they are for the HIV infection. I told you the 2 or 3 characteristics which are common with all of them. Then you should memorize the common toxicities of these antiretroviral drugs. Okay? no specific drug is asked as such, except for few toxic effects like I just told you in the previous lecture of MCQs, like the adenosine is notorious for causing pancreatitis. Okay, and then there is some drugs which cause neuropathy or they cause myelosuppression, ठीक है, like zidovudine that causes myelosuppression. So this is asked frequently in the MCQ, but you can be asked in another question that write down the toxic effects of antiretroviral drugs. So the method of attempting this question is, first of all, you will write the general toxicities which are commonly shared by all antiretroviral drugs. Then you will mention the specific toxicity. Similar question is also asked when you will do the anti-cancer drugs. So there are some toxicities which are common with all the anti-cancer drugs, and some of them are specific for the specific anti-cancer drugs. So this is the method to attempt this question. So with that, we move on. Other antiretroviral drugs are like entry inhibitors and integrase inhibitors, and we have already shown the classification in detail. So let's move on to the toxic effects of these drugs. Basically, the HAART toxicity, HAART stands for highly active antiretroviral therapy. Number one is lipodystrophy. They cause body habitus changes like there is central fat accumulation and peripheral fat wasting. I'll just be showing you the picture of the toxic effects. And the more commonly affected gender is the female, and at the older age are at risk. And frequent use of protease inhibitor makes them more vulnerable to this toxic effect. So as you can see, this buffalo hump in the heart treated patient, there is a fat pad at the dorsocervical area. Similarly, gynecomastia in the patient on heart therapy. This is also very important. Since gynecomastia is caused by a number of drugs, so as I told you earlier that when you see a unique adverse effect, then you should write down the drugs, or you should it should automatically come in your mind that this common adverse effect or this unique adverse effect is caused by which drugs. When you see gynecomastia, what thing comes in your mind? In my mind, there comes one drug, that is spironolactone. Okay, so you'll be covering another few drugs in the chemotherapy which also cause gynecomastia. So make a list of the drugs which cause gynecomastia along with the classification of antiretroviral drug classification. So this really brainstorms helps you to memorize things like there are drugs which cause ototoxicity, they cause renal toxicity, drugs which are notorious for causing cardiac toxicity. So it helps you to memorize the toxic effects better when asked from the whole course of pharmacology. Then there is another picture which is showing the peripheral lipoatrophy, as there is peripheral wasting, and as you can if you can recall, in the case of Cushing's there is lemon on the stick, so it is different from that one. So this can also be asked in the MCQ, and because in the Cushing syndrome it's very typical, you have done it in your physiology as well, there is central obesity and the peripheral muscle uh, wasting, but this one is different from Cushing's, of course. There is facial lipoatrophy as well. The toxicity, lipodystrophy, the mechanism is not very clear, but there is mitochondrial toxicity at the molecular level. You need not to know this in detail, but you should know that this is an adverse effect of this heart therapy. Other toxic effects of this HIV or heart toxicity are lipid abnormalities, which causes hypertriglyceridemias. There is increased risk of pancreatitis, especially when diadenosine is used. Then there is also coronary artery disease, and generally treated with fibrates or statins if there is dyslipidemias. And there is also caution that beware of the drug interaction because it leads to myositis. If you recall, if you use statins, then there is a risk of myopathies. So it is to be used in caution with these patients. Although for the dyslipidemia, you have to give these drugs, but it increases the risk of muscle dystrophies. Then another toxic effects of this heart therapy is insulin resistance, and it can lead to diabetes because insulin resistance is one of the major causes of type 2 diabetes. So you have to monitor the fasting glucose values, and if the patient becomes pre-diabetic, you can also start metformin. So these are the common toxic effects which are shared by various drugs like nucleoside and non-nucleoside reverse transcriptase inhibitors. Nucleoside ones are causing pancreatitis, lipoatrophy, hepatitis, lactic acidosis, peripheral neuropathies, whereas non-nucleoside derivatives are just causing rash, fever, nausea, diarrhea, and hepatotoxicity. So students, this is lactic acidosis. I hope this looks familiar to you. This is the adverse effect of metformin. But it's a rare adverse effect. It's not a common adverse effect. The common adverse effect of metformin is GIT intolerance. Okay, so this is also MCQ. Although the bigonide which causes lactic acidosis and now is not used and withdrawn from the market is fenformin. Then we have protease inhibitor which cause lipodystrophy as well, GI intolerance, hyperglycemia and lipid abnormalities. And these are the common adverse effects. Okay, like peripheral neuropathy, hematotoxicity, hepatotoxicity, diarrhea, skin rash, lipodystrophy, CNS disturbance, hypersensitivity and hyperlipidemia. Another very important thing which you should all know about this antiretroviral drug therapy is, okay, what is the indication? Do we have to start in all the patients, or there are who are the candidates for the treatment? Number one, treat all regardless of the viral load, symptomatic or asymptomatic. Symptomatic are those which are having the acquired immunodeficiency syndrome with severe symptoms. Asymptomatic who have the CD4 count of 200, less than 200 cells. And asymptomatic with CD4 count more than 200 but less than 350. So treatment should be generally offered to all the patients. What are the uses of this heart therapy? Of course, they help in treating the disease as these are the antiretroviral drugs. They also help in the prevention of this viral infection from mother to child. It also prevents the post-exposure prophylaxis, and it is also related to pre-exposure prophylaxis. So these are the outcomes of these heart therapy. So I just mentioned you earlier that there is the combination of the drugs given whenever you give the heart therapy. Why combination? Because it causes synergism, it reduces the toxicity and prevents the resistance. Now we move on to a brief outline about the COVID-19, although you all must be knowing it much more better than me and much more aware than me because it has been the talk of the year. And may Allah protect us all from this COVID-19. So it's a viral infection, basically the family of viruses called coronavirus, and antibiotics do not work against these viruses, only those patients who have superimposed bacterial infections in which we give antibiotics. Okay? So there are various drugs which are given as I mentioned earlier, like Azomax, which is azithromycin. It's a macrolide that is also used for the trial basis. Then there are certain anti-malarials like chloroquine and hydroxychloroquine that has also been tested against this disease under trial. Similarly, various anti-parasitic drugs like ivermectin has also been used. Then for hepatitis C, there are various drugs like sabosfavir that has been used in for trial basis. So you should be, at least this is just a brief outline or a news or bulletin which you all must know, because you are all the future doctors, and at least if someone asks you which drugs are given for the COVID-19, so you should just know which drug group is used commonly, or which drug group is successful, or which has been withdrawn or has been uh, created as the blacklisted drug because it does not cause any beneficial effect, it causes harmful effects. So these are all the trials going on. So you should at least go through the news or through social media so that you should know, okay, what are the various drugs which should be given in COVID-19 and which should not be given in COVID-19. So, as you all know that this disease was first originated in Wuhan, China on 30th December 2019, and then its origin was from the bats. That was in the China. Then there was Wuhan lockdown, and it was declared as a global health emergency on 30th Jan 2020, and it was named as COVID-19 and SARS-CoV-2 on 11th Feb 2020. And on 18th February, it was reported that the ultrastructure of this uh, viral disease, and till now there have been many trials, many drugs all across the world. So ये जो COVID-19 है, ये आपको किसी भी स्टेज पे आपसे कभी भी कोई भी पूछ सकता है. So it's your ethical and duty, आप इसको समझे कि यू शुड नो कि व्हाट्स गोइंग ऑन इन दिस वर्ल्ड. इतने भी अनअवेयर या इग्नोरेंट ना रहें कि अगर आपसे कोई पूछे कि क्या ड्रग्स यूज हो रही हैं तो यू शुड नो. ठीक है. एंड स्पेशली एट द लेवल ऑफ थर्ड ईयर यू आर गोइंग थ्रू फार्माकोलॉजी, यू मस्ट नो लिटिल बिट. इट कैन बी आस्क्ड इन योर viva as well. Okay, so this is how it looks like. So this is remdesivir, which is an antiviral drug, which was basically started for hepatitis C and other viral infection, but this has proved to be very effective in here also for COVID-19, and few hydroxychloroquine, which is an anti-malarial drug. The topic of malaria would be started inshallah after this lecture. Then this is injectable form of remdesivir, since no vaccine has been made till now, and scientists all across the world are on this process. Okay, students, with that we end today's lecture. So for your assignment, classify antiretroviral drugs. You can do it in the form of a flow chart, you can do it diagrammatically, or anything which makes it easy and convenient for me as well as for other teachers as well as for your colleagues to understand the classification. Make it an easier version. Then list of the drugs which cause gynecomastia, and you all know what is gynecomastia. It's a development of breast in the males. Then the list of drugs under trial which are successful or appear to be not successful against the COVID-19. So you have to write down the names. I have just shown you 2 or 3 drugs which have proved to be beneficial or contradictory. So this is your homework to do a little bit of brainstorming and submit your assignment. And for that you can have an extra time if you need to have a search out. With that we end today's lecture. Thank you very much, and Allah Hafiz.